Welcome back guys. Now in this video, let's discuss what is the effect of hypoxia on your blood vessels. Okay. See, whenever there is hypoxia, let's say, look at here, whenever there is hypoxia in my hand, you know what exactly is hypoxia means? Hypoxia means less oxygen available to the tissues. Okay. Now whenever there is hypoxia, you tell me what should happen. The blood vessels which are bringing the blood to this area, they have to bring more blood, okay, so that the blood vessels should undergo vasodilation. So whenever there is a hypoxia, okay, whenever there is hypoxia, the systemic blood vessels should have to undergo vasodilation. So more blood will come to this area. Along with more blood, more oxygen will try to come. So that oxygen will try to take care about the situation of hypoxia. Okay, so that's why here we say whenever there is hypoxia, okay, whenever there is hypoxia, see the hypoxia effect on systemic circulation. The systemic blood vessels will undergo vasodilation. Systemic blood vessels will undergo vasodilation, so more blood flow, more oxygen delivery to the tissues. But how this is different from the pulmonary circulation? If you look at the pulmonary circulation, see whenever there is hypoxia, the pulmonary blood vessels will undergo vasoconstriction. Why? Look at here. Let's say this is your lung. Okay, this is your lung and this is the area where there is hypoxia. Okay, this is the area where there is hypoxia. You tell me why blood is going to the lungs? First of all, the blood is going to the lungs to take the oxygen, to get the oxygen. The deoxygenated blood is going to your lungs. Okay, the deoxygenated blood, the pulmonary blood vessels. The deoxygenated blood is going to the lungs to get the oxygen. First of all, in this area, I am telling you, in this area there is hypoxia. Oxygen is not there. Okay. So, if oxygen is not there in this area, what is the point of sending blood to this area? Okay, if oxygen is not available in this area, what is the point of sending blood to this area? So, what happens? The blood vessels which are supplying this area, the blood vessels which are going to this area, which are going to go to this area, they will undergo vasoconstriction. So the pulmonary blood vessels undergo vasoconstrictions in the time of hypoxia, so that at least the blood will be diverted to the healthy areas. The blood will be diverted to healthy areas to get the oxygen. Okay. So whenever there is a hypoxia in your lungs, the pulmonary vasculature will undergo vasoconstriction, but the systemic vasculature will undergo vasodilation due to hypoxia. Now what they will ask in your exam, how this will occur? So whenever there is hypoxia, how your pulmonary circulation will undergo vasoconstriction. Okay. Now look at this. This is your pulmonary blood vessel. Let's say here is a pulmonary blood vessel. So whenever there is hypoxia, look here, the person is suffering with hypoxia. Let's say, look on these pulmonary blood vessels. These are the smooth muscles. Okay, here is a smooth muscle. Okay. Now on these smooth muscles, look, this is a smooth muscle. On the smooth muscles, there are these potassium channels present. There are these potassium channels located. Always potassium will try to go out of the cell. Potassium is going out of the cell. Always this is happening. Okay. Not during hypoxia, it happens all the time. Okay. Potassium is going out of the cell. But whenever there is hypoxia, okay, whenever there is hypoxia, what is happening to the status of these potassium channels? The potassium channels will close. So these potassium channels are working, or I should say that these potassium channels are sensitive to which levels? They are sensitive to oxygen levels, or I should say they are sensitive to hypoxia. Okay, they are sensitive to hypoxia. So that's why they are called as oxygen sensitive potassium channels. So quickly, whenever the person is having hypoxia, the potassium channels, which potassium channels? Oxygen sensitive potassium channels, they will close, leading to the accumulation of potassium. Potassium, the positive charge will start to accumulate inside the cell. When the positive charges are accumulating inside the cell, what happens? The cell will start to undergo depolarization. Because of the accumulation of potassium, the cell will undergo depolarization. When the cell membrane is undergoing electrically positive, when the cell membrane is undergoing depolarization, okay, immediately the cell is going to open the calcium channels. So these cells, upon depolarization, they are opening which channels? Calcium channels. So who is coming into the cell? Calcium is coming into the cell. So what is the role of calcium? So you know calcium is going to cause the contraction. Okay. So calcium is going to cause what? Contraction. So these smooth muscles will undergo contraction. The smooth muscle will undergo contraction. Whenever the smooth muscles are undergoing contraction, there will be vasoconstriction. So the contraction of smooth muscles is going to cause the vasoconstriction of the pulmonary vasculature during hypoxia. So this is the this is how the pulmonary vasculature will undergo vasoconstriction during the states of hypoxia. So at the end of the day, the point which I want you to know is what is the relationship between hypoxia and your blood vessels? Whenever there is hypoxia, systemic vasculature will undergo vasodilation, pulmonary circulation or the pulmonary blood vessels will undergo vasoconstriction. Look at the summary here. Hypoxia, whenever there is hypoxia, potassium will start to accumulate inside the cell. That will lead to depolarization of the smooth muscles. Depolarization opens the calcium channels. Calcium ions cause the vasoconstriction. Okay, calcium ion causes the contraction of the smooth muscles, which will lead to vasoconstriction. So with this, topic of hypoxia and your pulmonary circulation completed. Thank you.